Many of my patients in their 60s and 70s look at me with genuine confusion when they ask a simple question. Doctor, how much vitamin B12 is actually safe for someone my age? It's an honest question, and it reflects something deeper. Because by this stage of life, most people have already heard that B12 is essential for energy, memory, and nerve health. But what they haven't always been told clearly is how aging changes the body's relationship with this vitamin, and why what worked at age 40 may not apply the same way at age 65 or 75. Over the past 23 years of caring for older adults, I've seen this topic come up more and more often. Some patients worry they may not be getting enough. Others wonder if they're taking too much. And many are simply unsure whether B12 is something they even need to think about at all. What makes this especially challenging is that vitamin B12 doesn't always behave in obvious ways. You can have low levels without realizing it. You can also have normal levels, but still feel symptoms that make you question whether something is missing. And because the body changes gradually with age, these questions often appear quietly, without warning. One of the reasons this matters so much after age 60 is that your body's ability to absorb vitamin B12 naturally declines over time. This isn't a sign that something is wrong with you. It's simply part of the aging process. The stomach produces less of certain substances needed to absorb B12 efficiently, and this means that even people who eat well and take care of themselves may not absorb this vitamin as effectively as they once did. This can create a gap between what your body needs and what it actually receives. Many of my patients are surprised when routine blood work reveals lower B12 levels than expected. They often tell me, "But I eat healthy," or "I've never had this problem before." And they're right to feel surprised. Because unlike some health changes that come with clear warning signs, B12 changes can be subtle. Sometimes the first signs are easy to overlook: mild fatigue, changes in focus, or simply not feeling as mentally sharp as before. Other times there may be no obvious symptoms at all. At the same time, there's also a growing awareness of B12, and with that awareness comes new questions and uncertainties. Some people hear that B12 is water-soluble and assume that more is always better. Others worry that taking too much could be harmful, and many are caught somewhere in the middle, unsure what applies specifically to them. This uncertainty can be frustrating, especially when you're trying to make thoughtful decisions about your health. What I want you to understand is that your concern is valid. Your body at this stage of life deserves careful attention and understanding, not assumptions or guesswork. Vitamin B12 plays a critical role in protecting your nervous system, supporting brain function, and maintaining healthy blood cells. These are systems that become even more important as you age, because they directly affect your independence, your mental clarity, and your overall quality of life. But here is the key point that many people don't realize. The question is not simply whether B12 is good or bad, or whether you should have it or avoid it. The real question is balance. Your body needs enough to function properly, but understanding what is appropriate for you personally requires awareness of how aging affects absorption, metabolism, and overall health. This is why the conversation around how much is safe becomes especially meaningful after age 60. In my years of practice, I've seen how reassuring it can be for patients to finally understand what's happening inside their bodies. When people move from uncertainty to clarity, they feel more confident and less anxious about their health. And that confidence comes not from fear, but from knowledge. Knowledge that helps you understand your body with compassion and realism. As we continue, I want to help you understand why vitamin B12 becomes such an important topic in the later decades of life, and why asking this question now is not only reasonable, but wise. Vitamin B12 works quietly in the background, but it plays a central role in keeping some of your body's most important systems functioning smoothly. To understand why this becomes more complex after age 60, it helps to first understand how B12 normally enters and travels through the body. When you eat foods that contain B12, the vitamin doesn't simply pass into your bloodstream automatically. It goes through a careful, step-by-step absorption process that begins in the stomach and continues into the small intestine. You can think of it like a package that requires a special label and delivery route before it reaches its destination. Inside the stomach, B12 must first separate from the food it's attached to. This separation requires stomach acid, which acts like a key that unlocks the vitamin. Once freed, B12 then binds to a special helper protein called intrinsic factor. This protein acts like a protective carrier, guiding B12 safely through the digestive tract so it can be absorbed into the bloodstream. Without enough stomach acid or without enough intrinsic factor, much of the B12 simply passes through the body unused. As people age, the stomach often produces less acid. This is a natural and gradual change. Imagine trying to wash grease from a pan with less soap than you used before. The cleaning still happens, but it's less efficient. In the same way, with less stomach acid, the body has a harder time releasing B12 from food. Even if your diet hasn't changed, your ability to extract B12 may be reduced. The second important change involves the stomach lining itself. Over time, the cells that produce intrinsic factor may become less active. Since intrinsic factor is essential for transporting B12 into the bloodstream, having less of it is like having fewer delivery vehicles available. The vitamin may still be present in your digestive system, but without enough carriers, it cannot reach the tissues where it's needed. Once absorbed, B12 plays a critical role in maintaining nerve health. Your nerves are covered in a protective layer called myelin, which acts like insulation around electrical wires. This insulation ensures that signals travel quickly and accurately between your brain and the rest of your body. Vitamin B12 helps maintain this protective layer. Without enough B12, the insulation can gradually weaken, and signals may not travel as efficiently. This is one reason why B12 is closely connected to memory, balance, and sensation. B12 is also essential for producing healthy red blood cells. These cells carry oxygen throughout your body. You can think of red blood cells as delivery trucks transporting oxygen to every organ and tissue. Without adequate B12, the body may produce fewer or less efficient red blood cells. This can reduce oxygen delivery, which may contribute to feelings of fatigue or reduced stamina over time. Another important aspect to understand is how the body stores B12. Unlike many other vitamins, B12 can be stored in the liver for long periods, sometimes for several years. This storage system acts like a reserve tank. Because of this, changes in B12 levels often happen slowly. The body may draw from its stored supply when absorption becomes less efficient. This is why deficiency does not usually appear suddenly. Instead, it develops gradually, often without obvious warning signs at first. It's also important to understand that vitamin B12 is water-soluble, which means the body does not store excess amounts in the same way it stores fat-soluble vitamins. When there is more B12 in the bloodstream than the body needs, the excess is typically filtered by the kidneys and removed through urine. This natural regulation system helps maintain balance, ensuring that levels do not accumulate uncontrollably under normal conditions. As you age, these combined factors, reduced stomach acid, lower intrinsic factor production, gradual changes in absorption efficiency, and reliance on stored reserves, create a situation where maintaining appropriate B12 levels becomes more dependent on how your body functions internally, rather than simply how much B12 you consume. This is why understanding the science behind B12 becomes especially meaningful in the later decades of life. I remember a patient named Margaret, who was 72 when she first brought up her concerns. She was a retired teacher, very sharp, very thoughtful, and deeply in tune with her own body. She told me in a quiet and slightly worried voice that she didn't feel like herself anymore. She wasn't describing severe symptoms. There was no sudden illness. Instead, she spoke about small changes that had slowly crept into her daily life. She said she felt more tired than usual, even after a full night's sleep. She noticed that sometimes she would walk into a room and forget why she went there. And what bothered her the most was a subtle sense that her mental clarity wasn't as reliable as it used to be. She had always been organized and confident in her thinking. Now she found herself double-checking simple things like whether she had turned off the stove or locked the door. She wondered if this was simply part of aging, something she was expected to accept without question. She wasn't panicked, but she was unsettled. She told me, "I don't feel sick, but I don't feel fully well either." Margaret took care of herself. She ate balanced meals, stayed active, and remained socially engaged. From the outside, everything seemed fine, but internally, her body was undergoing changes that weren't visible. When we later reviewed her overall health profile, it became clear that her body's ability to absorb certain nutrients, including vitamin B12, had gradually declined over time. This wasn't because she had done anything wrong, it was simply the natural result of the physiological changes that occur with aging, particularly the reduced stomach acid and changes in absorption we discussed earlier. What Margaret experienced reflects something I see often. The body doesn't always send loud signals, instead it whispers. The changes are subtle, gradual, and easy to dismiss at first. Many people assume that feeling more tired or less mentally sharp is simply an unavoidable part of getting older. And while aging does bring natural changes, sometimes these experiences are connected to underlying shifts in how the body processes essential nutrients. Another patient, Robert, was 68 and had always been physically active. He enjoyed walking daily and took pride in maintaining his independence. Over time, he began noticing something unusual. He described a mild numbness in his feet, almost like a faint tingling sensation. It wasn't painful, but it was persistent. At first, he ignored it. He assumed it might be related to circulation or simply fatigue. But what concerned him most was how it affected his confidence. He told me he felt slightly less steady when walking, especially on uneven ground. This change affected him emotionally as much as physically. He became more cautious. He walked slower. He avoided certain activities he once enjoyed without hesitation. He wasn't afraid, but he was aware that something had shifted. And like many people, he wondered whether this was just part of getting older or something else entirely. In Robert's case, the explanation was closely tied to the role of vitamin B12 in maintaining nerve health. As we discussed earlier, B12 helps protect the insulation around nerves, allowing signals to travel efficiently between the brain and the body. When the body absorbs less B12 over time, nerve communication may become less efficient. This doesn't happen overnight. It develops gradually, often in ways that are easy to overlook. What's important to understand is that both Margaret and Robert were attentive to their health. They listened to their bodies. They noticed changes, even when those changes were subtle. And their experiences reflect something deeply human. As we age, we become more aware of the delicate balance that keeps us feeling like ourselves, clear-minded, steady, and capable. These experiences also highlight why understanding vitamin B12 becomes so relevant in later life. The changes are not dramatic. They are quiet, gradual, and often confusing. People wonder whether what they are feeling is normal, whether it matters, and whether it can be understood. And in many cases, simply having clarity about what is happening inside the body brings a sense of reassurance and peace of mind. As you move through your daily life, one of the most important things you can do is simply remain aware of how you feel, both physically and mentally, without assuming that every change is either harmless or serious. Your body has a remarkable way of adapting over time, but it also communicates with you in subtle ways. Paying attention to your energy levels, your clarity of thought, your balance, and your overall sense of well-being can provide valuable insight into how your body is functioning internally. These observations are not meant to create worry, but rather to foster understanding. One common misunderstanding I often encounter is the belief that vitamin B12 is either entirely harmless in any amount or, on the other hand, something that must be aggressively managed. The truth is more balanced. Vitamin B12 is essential, and your body depends on it for critical functions, especially as you age. At the same time, your body is designed to regulate many nutrients naturally. This is why understanding your individual health profile becomes more meaningful than relying on general assumptions or advice meant for everyone. Another misunderstanding is the idea that symptoms like fatigue, forgetfulness, or physical changes must simply be accepted without question. While aging does bring natural changes, it also brings increased importance to awareness and thoughtful evaluation. Your health after age 60 is not defined by decline, but by adaptation. Your body continues to work for you every day, and supporting it begins with understanding rather than fear. It's also important to recognize that decisions about supplements, nutrition, or any health-related adjustments should always be made in partnership with a qualified healthcare professional who understands your medical history. Every individual is different. Factors such as digestion, existing medical conditions, and overall physiology all influence how your body absorbs and uses nutrients like vitamin B12. This is why something appropriate for one person may not apply in the same way to another. I want to emphasize clearly and respectfully that you should never stop, start, or change any medications or supplements on your own without discussing it with your physician. Your healthcare provider has the full context of your health, including laboratory results, medical history, and long-term needs. Their role is to help ensure that any decisions support your safety and well-being over time. Health decisions are most effective when they are thoughtful, informed, and individualized. Your body has carried you through decades of life experiences, challenges, and achievements. It continues to deserve care, patience, and respect. Understanding nutrients like vitamin B12 is not about chasing perfection. It's about maintaining balance and supporting the systems that allow you to think clearly, move confidently, and live independently. I have seen many patients find reassurance simply by gaining clarity about how their bodies work and what changes are natural. Knowledge removes uncertainty. It replaces confusion with calm understanding. And that understanding allows you to approach your health with confidence rather than doubt. Aging is not a loss of control. It is a transition into a stage of life where awareness becomes one of your greatest strengths. By staying informed, by observing your body without judgment, and by maintaining open communication with your healthcare provider, you create the conditions for continued stability and well-being. You deserve to feel confident in your health decisions. You deserve to understand what is happening inside your body, and most importantly, you deserve care that supports your comfort, your independence, and your quality of life. I'm Dr. Linda Harrison, and my goal is always to help you understand your health with clarity, compassion, and respect.